My name is Joy Olver. I'm a consultant psychiatrist working in the North of Scotland Young People's Unit in Dundee. I looked at using the Mental Health Act to support care along with my colleague Dr. Stephen Anderson. This was key question 23, and we were looking at the risks and benefits of implementing the Mental Health Act for people with anorexia, looking at the interventions of application of the Mental Health Act and involuntary treatment. Comparators were waiting for, counselling to gain consent, and parental consent. Outcomes were patient acceptance, parent and carer acceptance, and treatment outcomes. We only found 2 studies which met the SIGN standards. Morris et al. Is a Scottish study, with the main author being Dr. Jane Morris. This study included children, as 4 out of the 7 units being looked at were child and adolescent mental health service units. They found that treatment requiring legal detention involved longer admission, and this was of a SIGN grade standard 3. The other study that we looked at was Klaus and Jones' study from 2014. This was an international systematic review looking at frequency, duration, type and effect of involuntary treatment for people with anorexia nervosa. There were 8 studies in total involving children, adolescents and adults, and across a range of countries: the USA, 3 were from the UK, Germany, 2 from Australia and Japan. The conclusion was that it was difficult to draw conclusions as there were small numbers of low quality studies, and this was graded as a 2++. So when we look at balancing the benefits and of harms, we found that there were comparable outcomes when looking at weight and BMI, comparing compulsory to informal treatments. We found that detained patients tended to have longer stays in hospital, but this was confounded because they tended to be of lower weight initially. The Clausen and Jones review showed that involuntary treatment was associated with higher rates of complexity, comorbidity, and more previous admissions. In other words, this wasn't just about severity of the eating disorder. Acceptability was not looked at. So, in conclusion, and to make recommendations, overall, the studies were consistent and show that compulsory treatment is regularly deemed necessary. Clinicians should consider use of the Scottish Mental Health Act when a patient of any age declines treatment and when criteria for implementation of this is met. There is a responsibility to provide compulsory treatment if there is a risk to a person's life or to prevent significant deterioration to their health and well-being. We also wanted to flag up that the Mental Welfare Commission for Scotland has a series of good practice guidelines which are published online to help clinicians caring for people with eating disorders. Thank you.